you. You did such a good job.
Huh?
You did such a good job.
Yeah, they did a good job and you did a good job. I got mine out. I followed all the directions, except I did have rice and I got a rice caught in one of the holes. First day of my season.
She just said that she had a rice grain fall into the extraction site hole. Well, we actually give instructions following tooth removal, wisdom tooth removal, to avoid any small grains or eating anything small that may fall into a hole, because your body treats it as a foreign body and start making that exaggerated reaction, and you may get swelling, pain, and so forth. You just got yourself a complication because of eating a small grain.
Senior year, and my face was like this, full of bruises. Hi.
Hello everyone, my name is Dr. Mo and I'm a general dentist. Today I'll be reacting to Charli D'Amelio I Got My Wisdom Teeth Pulled video. Stay tuned because this is going to be an interesting one.
What you guys? You guys are all over the place. They just took an x-ray of my teeth. Like that's the one.
So let's take a look at the x-ray. And first of all, the way we look at it, this is called a panoramic x-ray, also called as an OPG, and we run it like from one side and we scan the whole thing, and then we go down and scan the other side, and we also assess the structures all around, but I'll talk about things within the context of this video. We have 4 wisdom teeth, and the first one, this is, by the way, the upper right. Now if you're shocked, it's because whenever you're looking at an x-ray this way, normally the side is opposite. So this is the upper right, looks like partially erupted, means still it's not completely into the mouth, okay? And this is the second wisdom tooth in the upper, looks like it's erupted, but in a wrong direction, also still erupting. We also have the 2 lower wisdom teeth. They are also partially erupted, and if you can see this one, the lower left wisdom tooth is actually erupting at a wrong angle, and it's pushing into the tooth adjacent to it.
Wisdom tooth, that one hurt.
As well as the other one.
That's a wisdom tooth, that one hurts too. This one's causing some problems.
But yeah, these are my teeth after 2 rounds of braces and Invisalign.
So she says this is the set of her teeth after having braces. They look alright.
I hope they're straight. They had me take out all my earrings and I feel so naked.
Okay, I go so.
They asked her to take all of her earrings and accessories. I assume this is in relation to the x-ray. Why is that? Because all of these metals are going to be disturbing the x-ray image, and they will reflect as extremely just white spots. Okay, why is that? Because they will block the x-ray, these metals and all of these accessories. So if you have a necklace or if you have any accessories, an earring, whatever, we ask you to remove all of them for having the x-ray.
2 hours later.
Hi. Hi. You look great.
Thank you. You did such a good job.
Huh?
You did such a good job.
Yeah, they did a good job and you did a good job.
Thank you.
Yeah, I would argue she did a good job too, because I mean, definitely wisdom teeth removal is not easy on the patient as well. But by the way, the swelling does not normally happen like directly immediately after. What you're seeing is because they packed all of this, and I wouldn't use this much big size of a whatever they're using. So I would use a smaller gauze and restrict it to the extraction site.
You're so cute. I can't take it.
Okay.
Huh?
Okay.
You look great.
Yeah.
You look so great.
Very nice.
We went grab a little something to eat at the diner.
Is it good?
Yeah, and we went, and then we came back, and we were just waiting for them to call us, and then we're gonna pull the car in the back.
Is that?
So one of the instructions following any tooth removal, not only wisdom tooth removal, is to not eat or drink for roughly at least an hour right after, because you still have a fresh extraction socket, and And also there are other diet instructions which we will address as we go on the video.
Dad's here. He was on a phone call, but he's like right outside. Yeah, easy.
Okay.
Yeah. Well, outside of the office.
Okay.
Yeah.
Oh,
Yeah, he's here. Yeah, of course we're here. We were like literally 5 minutes down the road. We grabbed food and came right back. Yeah. Yeah.
Yeah, so it's normal to feel dehydrated following wisdom tooth surgery. Of course, it's very important to hydrate, but as we said, not in that first hour following having wisdom tooth surgery. And she said, I will wait. That means most probably her dentist or oral surgeon, whatever the healthcare professional there, mostly have instructed her. We don't know details, a bit vague, but to not eat or drink directly after.
Oh yeah. Amazing. I'm so proud of you. I know you were worried, but you're a little nervous, right? But you did so good. Look at you, all sitting up and everything. Great. You're welcome, sweetie.
Oh, you're very, very welcome. Very lovely.
oh wow.
That's all four. Yay.
She's so cute.
You're very welcome, love.
So what else?
Right now, you get.
So looks like she's looking at a pouch where they put the teeth removed in. Again, this is something that I'm heavily against. I mean, I would definitely not advise any patient to take their extracted tooth. You may say, well, it's part of me, etc., you know, and now Oscar in the comments section is going to fight for the people to take their teeth with them. It's not about this. It's just that your tooth, the extracted tooth, the infected tooth, or any tooth that you remove from your mouth, it just has a lot of bacteria, microbes. It's actually quite, I mean, I don't want to use the word like disgusting or something. So you don't want any form of cross-contamination. Somebody may take it. You yourself may be messing with it, may try to put it there or something. You just contaminate the extraction, suck inside. Some people may swallow it. You know, it's just a whole realm of complication. I do not, of course, advocate. I'm heavily against anybody to take their extracted tooth with them.
Get to go home and rest. Yes.
Let me see your teeth.
That is a lot of teeth. It looks like she just, I guess, removed all of them, because I heard them saying removed 4. Why is there some small pieces? Because it's possible that with some of them they were partially erupted, or they sectioned them, meaning they separated them into parts in order to remove them.
Oh, they're cute.
You can go home now.
Only one side works.
Only one side of your mouth works?
Okay.
Yeah, it's because they put medicine.
Oh.
Yeah, it'll work back. Where is she? She might be working. It's alright. You do love her.
Well, it's not okay, to be fully honest, because the anesthesia, granted given correctly, it should not like paralyze one side of your mouth, because what it does, it anesthetizes the sensation, you know, so that you don't feel pain, and so that for a short period of time after the procedure you don't feel pain as well. And there are other reasons why we use anesthesia, why we use adrenaline. I addressed it, I guess, in other videos. The reason I mentioned that it's not fine is to not be able to have motor control, meaning to be able to move one side of your face, because there's a complication called facial palsy. And what happens is the anesthesia we give it, you could argue a bit blind, because the needle goes into a particular side the dentist is precisely trying to reach, and you may either hit a nerve, or the anesthesia can go to a place where it shouldn't go, and hence as a consequence of this you may get that facial palsy. It's a complication. It's not a normal thing that's supposed to happen. It is normal to feel numb in relation to the sensation, and to feel like a bubbly feeling or a bit of like swollen feeling, right? Not of the area that was anesthetized, but I wouldn't say it's normal for you to have only half of your mouth and lips working.
And she loves you.
Oh, I can't smile as much as I want
You can't smile as much as you want to.
It is possible that she can move them, but she just feels too numb to do it and tired, so I'm not sure, but she says that she cannot even move them.
That's so funny.
Are you biting down?
I don't know. This time, yeah. This time, oh no. It's okay now. It'll come back.
Yeah, it'll come back.
So it will come back. She's referring to the normal sensation of her mouth, I assume, and yes, it's true. Once the anesthesia effect wears off, your sensations should come back normally. How long after the procedure and the administration of the local anesthesia will depend on what type of local anesthetic was used. Did the dentist or oral surgeon use a long-acting anesthetic, or did they use a relatively short-acting anesthetic? There's also an intermediate one, meaning one of a duration in the middle.
Wait, so why do you think it didn't go down the right way?
Because my mouth is numb.
So notice something, she's able to move that lower lip just fine, but probably because she feels a numbness on the upper one, because she feels numb in that area, she's not moving it properly.
I don't know what is going on. I just wanted water, and now I have to change my clothes.
And you can't use a straw. Why?
Because you get dry sockets. Is this?
That's true, actually. So you should not use a straw following wisdom tooth removal or any tooth removal, and the reason is you may get something called as dry socket, and the scientific term is alveolar osteitis. Alveolar referring to the alveolar bone which supports your teeth, and ostia, right, or osteo is just a term that refers to bone generally, and itis like a term in relation to inflammation and so forth. We're talking scientific terms. What is consideration related to? You should not use a straw, because when using the straw and there's that sucking motion, you may dislodge something called as a blood clot from the extraction site. When that blood clot dislodges, now you have the extraction socket with a dislodged blood clot, right? So what happens is it becomes like a dry socket, and it's an extremely painful condition. I talk extensively about this in my channel. Just follow your dentist and healthcare professional instructions.
This is what The Weeknd was talking about when he was like, I can't feel my face. Did he get a wisdom teeth out?
Yeah, I think so.
I can say day 2 and just notice. So notice she did not show rinsing of any solution or water or she's showing right now a chlorhexidine solution. I saw the label. Because for the first day, for the first 24 hours, you're not supposed to rinse or spit again, because rinsing or spitting during that period of time may, as a consequence, cause a higher risk for dry socket. Dry socket, the term that we discussed a bit ago. Secondly, if you notice her face, don't you see it a bit more swollen on day 2? Because as I said, on the first day, and especially immediately after the procedure, it's possible to not directly have the swelling or that enlargement of the face appearance showing. It could be on day 2 or day 3 or even a bit later. And mind you, this is just your body healing. This is just your body generally doing its work. Definitely, if you feel concerned with this, you could contact your healthcare professional. I talk in my on my channel how to alleviate, or what things someone could do to reduce that swelling?
Anyways, it's time for me to get back on my hot girl stuff. I'm gonna take a shower and get ready because I feel disgusting. Or maybe I'll like do my hair, try to make myself look pretty, even though I am. So I showered and I got dressed. I obviously still look crazy. I'm waiting for my mirror to be unfoggy so I can brush my teeth, but while I wait for that, I hate I've never dreaded brushing my teeth so much. It just hurts, so I don't want to do it. So yeah, that's what I'm dealing with right now. An excuse. Another thing. That's
Yeah, sure. I mean, of course, there's going to be some form of swelling following wisdom tooth removal. It's normal, okay?
what I look like. I look so silly. Another thing that the rest of my just took off. My lips are this. Do you think this will help me, or am I too far gone? Ow! Okay, my lips are literally peeling off. This is probably not a good idea right now, but we're gonna try this for the first time.
So if you're wondering what they think she's putting around her head, I'm not too sure what specifically she's using, but it can be possibly a form of compressions, right? Following wisdom tooth surgery, if you have a swelling, sometimes it's advised to use like a cold compressions, not the entire time. It could be cold, alternating a bit for another period of time with slightly hot compressions. Cold will help in reducing the swelling.
I literally just took the box. If my can't think straight. There we go. This one, it's pink. That changes nothing though. Ooh. It's like all the celebrities do, but not because I don't want them to see my face. It's because my face looks like it's decaying because it's green. It's like yellow here and under my eye, which is weird to me. So yeah, we're gonna go get that checked out. Okay, so everything is healing as it should.
Yeah, she looks a bit better. Of course, it's a gradual process. It's not, there's no instant recovery. Unless if you're a vampire and Brian Johnson. I'm just kidding. I love Brian Johnson. I did a video reacting to him.
Obviously I'm still bruised. She cleaned my sockets for me, which was nice. I really want this. I just got laser on my face, so they basically like lasered out a little bit of the swellness, and like it's already looking so much better. The laser.
Yeah, there's a form of laser application, I'm assuming, and you have to go for a specialist for this. There's, I guess, specific or special laser treatments where they may help aid in the alleviation of that swelling. Again, if you can afford, or if you could do that, not advising you to do that, but it is something that's available.
So I'm gonna start with my hair.
Okay, so she's using a straw, but this is just beyond the first few days.
Oh my goodness. Okay, so I was just playing with my stitches like in my mouth with my tongue, and a stitch fell out. Should I keep it? Should I sell it on Depop? $600. Charli's mouth stitch.
Whoa, $600 for a stitch. I mean, I guess someone would buy it and resell it on what is it called? Not Amazon, the other one. Anyways, so there are two types of stitches. There's absorbable stitches and there's non-absorbable stitches. Absorbable stitches most likely would be absorbed by the body over time, and non-absorbable stitches normally need to be removed by your dentist or healthcare professional on a follow-up visit. It is possible that one of the stitches fall out. Again, I think she said she's on day 5, so this meaning some of the healing is happening already, and her face looks significantly better. The swelling is really alleviated a lot, and she looks much more improved.
See how long those little strings are? They're trying to set me up.
So So it's not that long. If you know how long of a stitching thread we use in sutures, you would be more surprised. This is just like a small tiny stitch with a knot.
My face looks so much better. I feel like confident. And it's all I thought after I got my wisdom salt and some warm out of my Angelina Jolie cheekbones and facial structure. I'm going to try to get my
Okay, dude. So I don't know about Angelina Jolie stuff, but she looks better.
stitches out of my mouth. So what you're gonna need is a spoon, a cup, some salt, and some warm water. So this is what I look like now.
So if you notice, she's not really complicating things. I mean, she's just using salt and warm water and for rinsing, but this is like day 5 or later on. It's fine. It's just a few days later from the procedure that's done. I cringe a bit anytime a straw is shown. Again, I said it's just primarily within the first 24 hours. Later on, few days later, she's on day 5 or 6. I mean, should be okay. It's critically important when the extraction socket is relatively fresh in the first few days. I would argue I'm a better TikToker than her. Anyway.
Obviously.
Okay, so the rest is just makeup stuff, so I don't really care. Anyways, thank you everyone for watching. Thank you, Charlie, for this video. I enjoyed it a lot, and hopefully all of you benefited from this. Dr. Mo Dentist out.